SportsNOLA.com. Lenny Vangilder at Tulane University visiting with Dr. Greg Stewart from the Tulane Institute of Sports Medicine and longtime team physician here at Tulane. Dr. Stewart, y'all had a very important clinic here for coaches, trainers, EMS here at Tulane Tuesday. Tell us a little bit about what you guys went through this morning.
Basically what we did was go through appropriate care of the spinal injured athlete, and that's what we did. There's been some new changes with regard to protocol and equipment removal, now more being done on the field as opposed to the emergency room, but this was trying to get the vested groups together to have the conversation so that everyone's kind of on the same page on how to manage the student athlete.
In brief, for the layperson out there, how have things changed in terms of how you treat these injuries?
In the past, what we've done is gone and, you see people, they're put on a spine board, their helmet is left on, the equipment is left on, and now some of the change is that the people that are on the field, the physicians, the athletic trainers, the equipment managers, are the individuals who know more about the equipment, so it makes more sense for us to remove the equipment on the field as opposed to going to the emergency room where there are individuals who aren't familiar with the equipment.
For people who didn't have a chance to be at the clinic today, what is your advice to them as they get ready for another football season here?
I think the advice for all level of athletes, student athletes, whether it's youth, junior high, high school, collegiate, is to have a plan. Develop an emergency action plan. Know what you're going to do before it happens. Go through the scenarios. Know who's going to call for EMS if they're not already there. Who's going to open the gate. Make sure that access isn't blocked by garbage cans or cars that are parked. Make sure someone knows that they're responsible for calling 911. Somebody knows what the address is of where they are. Someone who can communicate all of this. So there needs to be a plan, and a lot of these things need to be thought out ahead of time so that everything goes as smoothly as possible, because there's always going to be the unexpected. So the more prepared you are, the better the student athlete's going to be cared for.
What did what happened 3 years ago with Devin Walker teach you about these situations and help you be better prepared for the next time it happened?
It's one of those things you hope never happens. At Tulane, we've been involved in doing this since the late 80s, early 90s, doing some of the education. I think what that did is really solidify the importance of being prepared and having an action plan and practicing and knowing what you're going to do.
You mentioned practice. That is the other thing. This session ended out here with a practice session where you actually had people on the board, in gear, people actually going through the process of what it took. It didn't go as planned. You had to go to plan B. The practice aspect of it, much as these teams will be practicing in the month of August to get through, the training staffs need to practice as well.
Absolutely. That the only way you're going to know how to take the equipment off, the right way of removing it, what the equipment's going to look like, how do you position your hands, all of those kinds of things has to be practiced. And kind of what I said at the beginning today is, if we're going to make mistakes, let's make it here today while we're practicing, so that when we have to do this, we're ready and hopefully don't make mistakes at that point.
Indeed, you're dealing with a life or death situation. Dr. Stewart, thanks for your time, and truly a very important effort here at Tulane, trying to help trainers across the region get ready for another football season and perhaps dealing with these situations.